Welcome to our mnemonic video on vomiting differential. Let's get started. This story will take place at Merlion Park in Singapore. And to the left of the scene, we see the Merlion fountain statue spouting water into the ocean. It almost appears as if this Merlion is vomiting. And this should remind you that this entire story is all about vomiting differential diagnosis. So let's check out some of the tourist attractions. The final stop for any Merlion Park visitor is always the soft serve ice cream stand. However, they serve the ice cream in small bowls rather than regular crispy cones. If we take a closer look, we can see a big stone in one of those small bowls. Well, a small bowl sounds like small bowel. And the fact that this stone is filling the small bowl, preventing it from being filled with ice cream, should make you think of a small bowel obstruction, which is a cause of vomiting. Treatment of small bowel obstruction generally involves non-operative management, while the diagnosis of the underlying cause is explored. Now, non-operative management includes keeping the patient NPO, as well as providing IV hydration, pain medications, and gastric decompression with a nasogastric tube. This way, we give the bowel some time to rest and resolve the obstruction on its own. However, if the obstruction doesn't resolve with bowel rest, then surgical management is considered. Now here comes a customer. He does not look well at all, and with vomitus around his mouth and a diarrhea stain covering his pants, he must have eaten some spoiled ice cream. Well, the vomit and diarrhea here should make you think of acute gastroenteritis, commonly referred to as the stomach flu, which can cause vomiting. Additional symptoms of gastroenteritis include fever, malaise, and abdominal pain. The majority of cases are due to viral infections, which tend to be mild, but can be bacterial, fungal, or even parasitic. Therefore, treatment is usually supportive by giving proper rehydration and often etiology specific. Looking at the owner of this ice cream stand, we see him wearing his luck chain made of candy-looking dyed beads and lemon. Candy-looking dyed beads are our symbol for diabetes, while lemon is our symbol for acid. Putting things together should make you think of diabetic ketoacidosis, or DKA for short. Now, DKA can cause vomiting, and it must be diagnosed quickly, as it's a life-threatening condition that can be the first manifestation for patients who have diabetes, or at least the way they may first present to you in clinic before it's diagnosed. In addition to vomiting, DKA can also present with fruity breath odor, as well as abdominal pain and Kussmaul breathing, which is deep, labored breathing seen at the later stages of acidosis. Recall that both the quick, shallow breathing initially seen in DKA and the labored Kussmaul breathing that comes later are both forms of compensatory respiratory alkalosis. Management of DKA includes IV fluids, reversing the underlying acidosis with sodium bicarbonate, correcting electrolyte imbalance, and administration of insulin. Now it's time to leave this ice cream stand and check out the next vendor. No tourist trip would be complete without a hot dog stand. And here we have one, right next to the ice cream stand. However, it looks like this young chef is having a hard time preparing some hot dogs. We can see his oddly shaped pancreas pan is caught on fire, and now he's running toward the river to put out the fire. Well, the flames in the pancreas pan should remind you of pancreatic inflammation, or pancreatitis, which is another cause of vomiting that classically presents with epigastric pain radiating to the back. And this condition can be acute or chronic, and it's treated with bowel rest, as well as IV fluids, antibiotics, and pain control. Now, it seems like burning the pancreas pan is a daily routine for that young chef. And that's why the owner of the hot dog stand has decided to make a surprise visit for an inspection today. And he's very angry at the sight of his chef's flaming pan. And we can tell by his bulging out eyes and the steam coming out of his ears. And like pressure cookers and tea kettles, releasing steam is generally a sign of high pressure. And in our case here, we can say the owner's head pressure is high, or he has an elevated intracranial pressure, which is another cause of vomiting. And in his rage, though, he has also dropped and broken a pair of his eyeglasses. Now, let his bulging eyes and broken eyeglasses remind you of the papilledema and blurred vision that accompany elevated intracranial pressure. Many causes can lead to increased intracranial pressure, like mass effect, obstruction of some kind, like obstructing CSF flow, or any brain inflammation, an electrolyte abnormality, and there's many more. But the treatment is to decrease that intracranial pressure, and that can vary from conservative measures like having the patient hyperventilate or elevating the head of the patient, or more critical measures like hypertonic saline infusion and ventriculoperitoneal shunt placement. In his inspection, the stand owner decided to bring his note, which contains all the previous incidents for this young chef. As he writes down the new incident so furiously, his pen caught on fire. Well, a pen sounds like appendix. And if you look closely, you'll notice that the pen is shaped kind of like an appendix as well. Well, this appendix pen and the flames are our recurring symbol for inflammation. And that should make you think of appendicitis, or inflammation of the appendix. Well, appendicitis typically starts by presenting as periumbilical pain, and then it migrates down to the right lower quadrant later. And oftentimes, early appendicitis really just looks like gastroenteritis. The patient's just vomiting or nauseous, and they kind of have this vague abdominal pain. And it's not really obvious that it is appendicitis, but later it will settle in that right lower quadrant. So always remember, in a patient who is vomiting, you need to think of appendicitis. Now, as far as the physical exam goes, classically you learn that you'll see tenderness at McBurney's point, which is a point that is 2/3 the distance from the umbilicus to the anterior superior iliac spine. Other physical exam maneuvers that can help evaluate for appendicitis include Rovsing sign, Soas sign, and obturator sign. And the definitive imaging for appendicitis is a CT of the abdomen. And this will show bowel wall thickening around the appendix and periappendiceal fat stranding. And treatment involves antibiotics and surgical resection of the appendix. Now, looking past the hot dog stand, we see that the food is not the only attraction here at Merlion Park. Arcade games are also a popular feature. And let's take a look at this little boy playing with the pinball machine. And he looks as if he should have stayed home today instead of visiting the park. His hand is over his mouth and seems more preoccupied with trying to stop himself from throwing up than actually playing the game. Let's take a closer look at the design of the game that he's playing. The green pinball pathway looks just like the structure of the biliary tree. And you can make out a gallbladder, cystic duct, and even a liver-shaped area in the upper left corner of the screen. This is our recurring symbol for gallbladder and biliary tract diseases, such as cholelithiasis, choledocholithiasis, cholecystitis, cholangitis. All of these cause right upper quadrant abdominal pain, and obviously nausea and vomiting, which is why you need to be thinking of these gallbladder and biliary tract diseases in your patient who presents with vomiting. And the diagnosis is usually by ultrasound, and that can detect biliary sludge, stones, or inflammation in the gallbladder. But oftentimes a CT scan is used. Well, this boy vomiting on the gallbladder pinball machine should remind you that gallbladder and biliary tract diseases can cause vomiting. The sun is shining brightly in Merlion Park, but it must be a fall day. The maple tree to the right of the scene is losing its leaves, and we can see its helicopter seeds drifting down to the ground, piling up below the tree. Helicopter seeds piling up should remind you of Helicobacter pylori, a bacteria that can cause peptic ulcer disease, which is yet another cause of vomiting. Now, peptic ulcer disease is treated with a combination of clarithromycin, amoxicillin, and a proton pump inhibitor. Oftentimes you call that triple therapy. Now, in front of the maple tree, we can see a homeless man strolling through the park. He's been feeling an unusual air draft around his epigastrium. So he took off his sweater and he's now inspecting it closely. Well, the sweater has an interesting stomach design knitted right into its center. But unfortunately, there's a sizable hole right in the middle of that stomach figure. I guess he likes to wear this sweater that has a stomach on it as a way to remind other people who have compassion on the homeless to feed him some food, because they're often hungry. Well, with that hole in the middle, that should actually make you think of a perforated peptic ulcer. And a perforated peptic ulcer is another differential of vomiting. And this time, it will present with bloody vomiting. And usually that requires surgical intervention. Now, it looks like this man isn't the only one breaking out the warm fall clothes. In the middle of the park, this girl is wearing a green beanie, but it looks like she may have grown since last fall, as the hat is now too small. And just now, she's clutching her head in pain as the beanie compresses her head, causing redness below it. And the tightly fit beanie represents how the meninges tightly envelop the brain, so there's little to no room for expansion. That's why inflammation of meninges, or meningitis, often presents with a headache in addition to vomiting. And this little girl is also grabbing her neck and has a slight bend to her knees to remind you of the nuchal rigidity, positive Kernig sign, and Brzezinski sign that can be associated with meningitis. Let's take a look at our next visitor. It looks like not everyone in this park is content with ice cream and hot dogs on this chilly fall day. And to the left of the scene, we see a man who has brought his alcohol to the park. Next to his glass of alcohol, we see a bottle with a skull and crossbones on it, a symbol for hazardous products like toxins that can cause poisoning or death. Well, the alcohol in the toxins bottle next to it should remind you to think of alcohol or toxins as a cause of your patient's vomiting. And here comes his friend to join him at the table. Well, his friend has chosen to forego the alcohol and decided to bring a pack of GU electrolyte drink mix. Well, notice that he drinks the concentrated mix without diluting it with water, which could cause him to have an electrolyte imbalance, which can ultimately cause him to vomit. This idea should remind us that electrolyte abnormalities can cause vomiting. And treatment includes repleting the deficient electrolytes and looking for the underlying cause of that electrolyte abnormality. Seated in front of the maple tree is the next arcade game. This punching bag station must be very popular. Notice that the heart-shaped punching bag has black streaks on it from taking so many punches from tourists. This bruised-looking heart is our symbol for acute coronary syndrome, which is a constellation of symptoms due to decreased blood flow in the coronary arteries. An acute coronary syndrome, or ACS, is an umbrella term for unstable angina, non-ST segment elevation, myocardial infarction, or NSTEMI, and ST segment elevated myocardial infarction, or STEMI. So unstable angina and STEMI are all three conditions that can cause classic changes on an ECG. And we'll bring our three stools to help you remember those findings. From left to right, we see an inverted stool to represent an inverted T wave. A tall stool with a broad base representing the ST segment elevation seen in a STEMI. And a short stool with a broad base stands for NSTEMI. The decreased blood flow in acute coronary syndrome can cause ischemic damage to the myocardium, which in addition to the classic chest pain, it can present with symptoms of nausea and vomiting. And this bruised heart-shaped punching bag and the three stools next to it should remind you that acute coronary syndrome can be another on the differential diagnosis for vomiting. Looking into the distance, we can see that arcade games aren't the only form of entertainment at Merlion Park. This vertical drop tower ride is a crowd favorite, although it's notorious for its riders to vomit while on board. Well, vertical sounds like vertigo. So this vertical drop amusement ride should remind you that vertigo can cause vomiting. Now you know why the riders of that drop tower vomit all the time. Anyway, vertigo is a sensation of the world spinning while sitting still, and it can be either a central vertigo or peripheral vertigo. Central vertigo results from lesions of the balance centers of the central nervous system, like the cerebellum and the brainstem. So you can think of central as central nervous system, while peripheral vertigo results from disorders or lesions of the inner ear and the vestibulocochlear nerve, the 8th cranial nerve. Now, differentiation between the central and peripheral vertigo is achieved via the Dix-Hallpike maneuver, a physical exam maneuver that involves a series of head and neck manipulations and evaluation of the resulting nystagmus patterns. So if the patient develops vertigo after you perform the Dix-Hallpike maneuver, then you think of peripheral. So Dix-Hallpike, peripheral vertigo. Now let's leave those tourists to enjoy their vertical drop tower ride on this fine fall day, and we'll take a look at the guy standing in front of the ride who's having a different experience with the chilly weather. The weather appears to have caused this man's allergies to act up. Notice how he coughs so hard that it's causing him to vomit. Well, this coughing and vomiting man should remind you of post-tussive vomiting, which is a classic presentation of Bordetella pertussis, the bacteria that can cause the whooping cough. Now, whooping refers to the specific noise made on deep inspiration after a coughing fit. Fortunately, there's a vaccine against Bordetella pertussis, so nowadays it's less commonly seen. Regardless, if somebody's coughing so much, they can have post-tussive vomiting. So when your patient has vomiting, be thinking of a post-tussive cause. Now here comes this man's pregnant wife to see what's causing him so much distress. As she gets closer, she sees that he's vomiting. And the sight is so gross that she can't help but vomit as well. Well, this pregnant woman vomiting should make you think of hyperemesis associated with pregnancy. Now, vomiting in the form of morning sickness is common in the setting of pregnancy, secondary to the increased beta-HCG levels in the first trimester. And this condition is usually treated with hydration and antiemetics, but it could require hospitalization if the patient developed dehydration, which can happen in cases where the vomiting is severe enough. And with that, you have everything you need to know about the differential diagnosis of vomiting.